Health Minister Jane Ruth Aceng, her junior minister Anifa Kawoya, World Health Organization Country Representative Jonas Stagen, and Professor David Serwada of the National Task Force on COVID-19 addressed the country on the status of the pandemic in Uganda since the implementation of the most recent lockdown measures. According to Minister Aceng, the impact of the lockdown on infection rates is not yet clear and the peak of the current wave might still be ahead.
Given the long incubation period of the virus, the effects of the current lockdown may be seen after 3 to 4 weeks. According to our scientists, the country will most likely reach the peak of the daily number of cases between the end of July 2021 and August 2021, before we start registering a gentle drop in cases.
Aceng reiterated her ministry's focus on
1. Enhance measures to interrupt transmission of COVID-19 among healthcare workers and the general population. 2. Enhance risk communication and community engagement. 3. Streamline and strengthen home-based care for COVID-19 mild and moderate cases. 4. Increase the capacity of our health facilities to optimally manage COVID-19 cases. Sustain continuity of essential health services and smoothen the access to medical emergency services.
And on vaccination, the minister said 285,600 doses are expected in a month under the dose-sharing arrangement through the COVAX facility. A donation of 300 doses from the Sinovac vaccine from China to be delivered this month. Another of 668,800 doses are expected from the COVAX facility in August. 2 million doses from Johnson & Johnson vaccine through the Afri-Exim Bank and AU, whose initial legal requirements for procurement they have concluded. And 9 million doses through the COVAX facility under the cost-sharing framework. The minister says they have finalized the legal procurement requirements and remitted the money.
The Ministry of Health is also at different stages of engagement to acquire vaccines from Cuba, Russia, China, and the United Kingdom besides the COVAX facility.
This comes at a time when several Western countries are considering the implementation of vaccine certificates, which would restrict entry for people vaccinated with especially Chinese vaccines and those from the COVAX facility.
The WHO does not promote vaccine certificates because they put people into a disadvantage for traveling. So, although we understand some governments and some bodies will implement vaccine certificates.
But the World Health Organization country representative says there are ongoing discussions over the issue. As the country enters day 14 of the second lockdown, the ministry is warning against self-medication and home oxygen administration for COVID-19 patients.
I would like to appeal to all those who test positive for COVID-19 to stop interacting with people within their households and beyond, even if they are asymptomatic. However, if you have symptoms, ensure that you get linked to care in a timely manner. Remember, COVID-19 is preventable. Let us observe the standard operating procedures, respect the 42-day lockdown, and stay safe.
Uganda has so far vaccinated over 1 million people and hopes to vaccinate more than 20 million people in phases. Edward Mhumza, NTV.